One of the Children's Cause for Cancer Advocacy's webinar. Thank you all very much for attending. We have a very full crowd today. My name is George Dahlman, and I'll be your host for today's webinar. This is the first in a series that we're doing this year that Children's Cause is hosting to inform and empower patients and family members who are going through the struggles of a childhood cancer diagnosis. All of us involved here know that when we first go through this and get that news, that throughout the cancer journey, even after diagnosis, the patients and families usually face a pretty wide array of challenges and struggles, and often need some help and somewhere to turn to for that help. And today's webinar is intended to offer some suggestions on where you can go and what resources are available. The first thing I want to do is just go over some reminders and housekeeping items. Today's call, so you know, is being recorded and will be available on our website at childrenscause.org. The format is really intended to be very informal and conversational, and we have some slides to present and some great panelists to present them. During the course of the webinar, everyone will be on mute, but there's an opportunity for you to post questions on the right-hand side of your screen in the Q&A box, and we'll be counting out some time at the end to get to those. We've also included some handouts from our speakers that you're free to download and review, and those are also available on the right-hand side of your screen. And at the end of the webinar, you'll be automatically directed to a post-webinar survey. Please, if you can, take a few minutes and let us know what you thought and make any suggestions for future webinars. We are doing these on a regular basis, and we want to be helpful and provide things that people really need. So today, to help us understand some of the resources that are available for patients and their families, we have several great panelists. First up is Nancy Sincata. Nancy is a licensed clinical social worker and nationally recognized expert on regarding issues for children and families when they're faced with cancer. She's currently the psychosocial director at Camp Sunshine in New York, serving about 750 families annually. I've always felt that social workers were often the first stop for families, and they're very much the triage masters of patient navigation. So it's great to have Nancy here to help us tell us about how she goes about her work. Also with us is Beth Moore. Beth is Executive Vice President for Corporate Communications at the Patient Advocate Foundation, which provides case management and patient assistance programs. Beth has also been in a variety of other leadership roles at PAF, helping them develop the organization's program strategy and mission delivery policies. And if any of you are not familiar with it, Patient Advocate Foundation has always been the go-to source for many patients struggling with insurance and financial issues. We also have with us some of the more prominent leaders in the childhood cancer community. Joe McDonough, who is the founder of the B+ Foundation, which was created in honor of his son Andrew, and a founding member of the Coalition Against Childhood Cancer, is with us, along with Joey McMahon, who is Vice President of Impact Investment at KBI. Has been working in the childhood cancer community since he was 15 with his mother's group at Duke's Children's, and then working in a nonprofit to improve the environments for children's hospitals nationwide. Both of them will go over, many of you may have seen the Hope Portal. They helped create this, and it's now widely available to the community at large and being adapted by many of the cancer organizations, childhood cancer organizations. And in fact, you can see it on Children's Cause website as well. So I want to thank all of the panelists here for taking the time to be with us today and give us the benefit of their thoughts and insight. And Beth, I'd like to start with you. If you could tell us something about PAF and the kinds of services that you offer to patients, and particularly how they affect pediatric patients, that'd be great.
All right. Hello, and thank you, George. I really appreciate you having us on today's webinar. And so let's just talk a bit about Patient Advocate Foundation, and I'm so pleased that we can serve as a resource for those of you on the phone today. So Patient Advocate Foundation, we're a 501c3, we're a national nonprofit organization, and we were founded more than 20 years ago with a mission of ensuring that patients and their family members can access prescribed care that they can maintain and preserve their financial stability during times of illness, and that they can understand their employment rights and entitlements during times of illness. Oh, thank you, George. I was having a challenge moving. There we go. There we
Me
go.
too.
Thank you. So here we go. Here's our official mission. And again, we do this through we deliver this mission through a staff of professional case managers, and we assist patients from across the country, both through case management services, through educational online resources, and through our financial aid programs, all the way that span all the way from our copay relief program for pharmaceutical copayment support down to our small grant financial aid funds. And to put it in perspective, let's see, I'm having challenges advancing the slides. My apologies. Okay, there's some of our, just to put it in perspective, so last year in 2016, I'm actually working on the data for 2017 now, but we actually served more than 105,000 patients directly nationwide. We assist any patient with a chronic, debilitating, or life-threatening disease. So while we are founded and have strong roots in the cancer community, and the vast majority of our patients have some type of a cancer diagnosis, we also assist patients with neurologic conditions, cardiac conditions, genetic anomalies, and for children specifically, we see everything from cystic fibrosis to premature birth, so to craniofacial disorders. So again, focusing on the practical issues and barriers that these patients face. So let's talk about just briefly about our case management services. This is where I want to start because I feel that this would be most valuable to those of you on the call today. So our case managers, we directly assist people. We don't just provide resources and offer navigation tips. Once a patient calls us through our toll-free hotline number, they're paired with a case manager who is a specialist in their particular need or particular issue. We conduct a comprehensive needs assessment, and then our case manager stays with you throughout the course of your case. Many times when we evaluate our data, we see that patients come to us with one issue. Let's say, for instance, they're seeking a second opinion at an out-of-network facility, and their insurer is denying them access. Well, our number one priority is going to be to gain approval for that second opinion. However, we then learn that perhaps the family needs transportation assistance, that they have out-of-pocket medical expenses and debt that they need assistance with, and our case managers follow them from entry into our system all the way through resolution. And on average, we assist with more than 2.8 unique issues per case. And it takes more than 20 interactions on behalf of each patient to resolve their issues. So our core competencies include insurance navigation, debt crisis assistance, screening and enrollment in insurance and social programs. That does include SSDI, SSI. It includes Medicaid, CHIPS programs for children, the state CHIPS programs, as well as individual charity programs that may exist within the medical communities and facilities, as well as other nonprofit organizations. And so that's what we do within our case management division. We also offer patient education and empowerment. You'll see a supplemental resource list that I provided, and this offers some direct links to some of our most useful publications. Things like maximizing your benefits, navigating the appeals process. And the thing that's unique about our resources, we want to provide you with actionable steps and tangible examples, almost like a roadmap to move you through particular aspects of an illness. We offer financial aid programs. Unfortunately, we don't have a financial aid program at this moment that's really targeted to pediatric cancers. Right now we have things like our metastatic breast cancer financial aid fund and our Merkel cell carcinoma financial aid fund. Our copay relief program, please visit us at copays.org. We serve a myriad of diseases through our copay program, and that is specifically for insured patients who cannot afford their out-of-pocket pharmaceutical expenses. I did mention that our case managers, that we directly intervene on behalf of our patients, and we've been doing this since we were founded in 1996. So last year, through our case management division specifically, we assisted more than 20,000 patients. We resolved more than 36,000 unique issues, and you can see the contacts. And we talked about how we help debt crisis, cost of living, screening and enrollment into insurance programs. I do want to touch on the fact that we also work with patients and their families on the marketplace enrollment, and we will actually conduct an evaluation for you of your family's health care needs and compare that against the available marketplace products that are available in your area. That's extremely important when we're talking about any open enrollment period, in fact, this applies to. So a lot of you right now may be going through open enrollment periods with your employer. It's very important to look at any pharmaceutical products and compare those against your pharmacy benefits, as well as your providers against the in-network provider list, and then perhaps your child's treatment protocol if one has been established. So, can you hear me? Hello? Hello?
I can hear you.
Nancy, are you on?
Yes, can you hear me? Can you hear me, George?
Hello.
Hello? I'm on. I'm on. Can you hear me? Hello?
I can hear you.
Hello.
Oh, thank you.
I can hear you. I think George once again lost his ability to hear, but you can just continue on.
Okay. And to the audience, my apologies. I hope that you can hear me. So you can see here the screening and assistance that we discussed, insurance navigation.
Hello.
And
okay, what happened here?
it looks as if George is taking the reins. My apologies again. Let me see if I can advance this.
Folks,
All
if you can hear
right.
me, I think we're having some technical difficulties. I lost Beth, and I'm not sure if any of you can hear her, but I'm going to try to reconnect this.
Okay.
Okay. So Nancy, you can hear me?
I can hear you.
Yeah,
So I'm
very
thinking
awesome.
that means that the audience can hear you.
That's what I think may be the case too. Well, for the sake of sensitivity to time and in hopes that the audience can hear me, let me just dive right into some of the additional material that I wanted to share with you guys, because my purpose today is really to introduce you to the resources available through Patient Advocate Foundation and make sure that if there is a service or a program that we can offer that would assist you, that you know how to access us and that you're aware of what they would be. So when we talk about debt crisis assistance, many of our families and patients, when they're dealing with an illness, experience financial crisis. The income levels in the household may change. They're faced with out-of-pocket medical expenses. They're faced with travel expenses that now have come into their budget that didn't exist previously. And our case managers directly work to negotiate write-offs, to enroll patients into charity care programs, and to help reconcile coding and billing errors to make absolutely certain that that insurance is in fact covering what should be covered. So these are a little bit of the services that we offer for debt crisis assistance. Let's just move forward, and I can share with you a figure that's interesting. So we negotiated more than $31 million in debt relief on behalf of our patients alone last year. So that's a significant amount. If we talk about some of our top resolutions, you'll see that we facilitated and obtained medical and pharmaceutical co-payment assistance. We assisted directly with screening and enrollment into the marketplace exchange plans, facilitated and secured free transportation assistance, and that is ground transportation as well as air transportation. Another thing that we do, we have a fair number of patients, particularly those in the pediatric community, that may require inpatient care and their families will need temporary lodging, and we assist and help coordinate any of the needs, the practical needs that you may have if your family is facing out-of-town care. We do a lot of work within the disability system. This is within SSI and SSDI, and as you know, obtaining a disability designation really opens up a timeline to things like COBRA extensions. It starts the clock on Medicare benefits. In some states, it's a prerequisite to obtaining Medicaid coverage. So our case managers are experts in understanding how the various programs intersect with one another in ensuring that patients and their families maximize those benefits. And finally, you can see down at the bottom some of our top insurance issues that we dealt with. All right, I'm having a little bit of technical difficulty advancing the slide, but I do want to talk about some patient educational tools that we have. You can visit www.patientadvocate.org /publications, and that actually has a myriad of links that takes you directly to things like our coverage access guides, Words That Matter, patient empowerment series, the National Uninsured and Underinsured Resource Directory. Those directories are available on mobile apps as well. And all of our publications and resources, as well as our services, are free of charge to patients and their families. A couple of titles that you may have a keen interest in that could potentially benefit your family. The first one is Common Roadblocks to Care Using Your Benefits. That is an excellent publication. You can find it on our additional resource list. Making the Most Out of Your Insurance, A Patient's Guide to Navigating the Appeals Process. And then Topics through our Patient Empowerment Series. It's an on-demand educational webinar. We have got a myriad of topics, but some of which are extremely pertinent. Genomic versus genetic testing, what it means to your health care, affording medications and prescribed drugs, your options for accessing second opinions, your plan's drug formulary, and finally, a segment on clinical trials, a pathway to cutting-edge treatments. All right, let's talk just a little bit about, and these are case studies that I want to present to you very briefly, and I just want to offer these as tangible insight into actually how we do what we do to help patients. So what does PAF do for the duly insured? And again, these aren't all pediatric in nature. However, insurance issues unfortunately don't discriminate against age, and oftentimes families face these same types of barriers regardless if the child or the patient is 2 or if they're 80. So let's just look at some common issues. So in this case, after care had been approved and delivered, the federal insurer who covered the female patient retroactively canceled their coverage due to marital status. And what occurred is that the patient's former husband notified the OPM, Office of Personnel Management, of their change in marital status, but continued to pay premiums for the employee +1 as instructed. And 13 months after his first letter to the OPM, he received a premium refund and notification that the wife's policy had been retroactively canceled back to the date of their divorce. And when that occurred, the patient was held responsible for the 20% Medicare cost share associated with her heart valve replacement, and she was unable to afford this on her limited income. So what PAF was able to do, and what we do routinely, we were able to unravel the full timeline of events regarding this patient's insurance eligibility. We reviewed all of the insurer's explanation of benefits against the patient's billing record to make sure that they had, in fact, been paid properly. That's critically important. And understanding that timeline, those timelines are often complex, but without understanding what your timeline is, it's challenging to make sure that you're maximizing your benefits. The second thing we did, we negotiated with her individual providers to obtain substantial reductions in the cost share amounts owed by the patient. So in other words, we tried to reduce the cost burden that had been unexpectedly placed on her. We also successfully negotiated the full write-off of some of her medical bills. We facilitated applications to a private financial aid fund, and that resulted in a $1,000 grant to help her with some of her medical expenses. And the appropriate identification and documentation of her coverage timeline then allowed the patient to obtain a Medicare supplement despite the fact that she had missed the enrollment period. So again, unraveling the full timeline relative to her coverage was really the key in this case, and it was quite complex. All right, so let's look at the underinsured. What does PAF do for the underinsured? So in this case, the patient underwent treatment in 2001, 2002, and clinical trials in 03 and 04, and he had a chronic disease that required continued care throughout his life. He came to us because he could not afford the out-of-pocket treatment cost of $25,000 even after he had received copay assistance from another organization. And due to the inability to afford the out-of-pocket treatment, the drugs would not be dispensed, and he could not access his medication at all. So what we did, we researched and determined that the patient qualified for PAF's copay relief program. We referred the patient to that program. That staff conducted an intake and an application on the patient's behalf. He was deemed eligible, and he received an additional $7,500 annual award that allowed his patient's prescribed care to begin. And that was extremely important. That's just an example of what we do with the underinsured. We often see access to medication as a barrier. And finally, let's talk about the uninsured. So what did we do for the uninsured? So in this particular instance, it was a male, and he lost his job. He was uninsured, and he did not qualify for the marketplace credits in his state due to his income. And he needed assistance to receive follow-up care and to address unpaid medical bills. So we facilitated a conference call to the hospital's billing department that resulted in approval for 100% charity write-off of his bills at the hospital. We then contacted as a third-party supporter through conference calls his other medical facilities involved in his treatment, and each of them agreed to match the write-off provided by the hospital. Ultimately, this patient was relieved of $27,498 in medical debt. And through our outreach to the hospital, we were able to enroll him as well in a charity program for care that secured his access to future treatments and care. So these are just some case studies and examples of what Patient Advocate Foundation does for patients and for their families. And we sincerely hope that we will be able to assist you in the future. If you have any needs, don't hesitate to contact us. Our telephone number is toll-free, and it's 800-532-5274. Two other resources I want to close on. These are a bit off topic, but both are important and relevant to this audience. So first of all, PAF, we operate in a Scholarship for Survivors program. And this is an academic scholarship program for patients age 25 and under who are pursuing secondary education. And right now, this is, in fact, our application period. We're accepting applications. I think it's through February 24th, but I've provided the website on that additional resource supplement sheet. Please feel free to visit Scholarship for Survivors if you know a young person who could use some assistance with their college tuition. And finally, I wanted to mention the Livestrong Fertility Program. We have been partners with Livestrong for many years. That is a very unique, one of its kind program in our country. It helps young people preserve their fertility uh, prior to treatment and after treatment for cancer. And there's fertility counseling that's available, as well as direct financial assistance for fertility treatments. And so I would encourage you to visit Livestrong Fertility if you have a child or a young adult whose fertility could potentially be impacted by treatments and therapy. And again, I thank you for your time. And George, I turn it back over to you.
Great. Thank you very much, Beth. I've had audio problems, so I've switched to the phone now. Hopefully it'll still work. Thank you very much. PAF is definitely, as I said, a go-to source for a lot of insurance and financial issues, and a lot of drug assistance programs too. Nancy, if we could turn it over to you,
Sure.
I will. I'd be happy. Nancy, as I said,
Yes.
is involved with Camp Sunshine and as a social worker. So, Nancy?
Sure. And you're going to do the slides on your end, right?
Yes.
Okay.
Working on that.
Okay. So Camp Sunshine is actually in Casco, Maine, and we are a retreat for families of children with life-threatening illnesses. We started as a program exclusively for children with cancer, and the majority of our programs are for children with cancer and their families. So when you think about it, the impact of childhood cancer, I think everybody on the line who's living with a kid who's been diagnosed with cancer understands that the diagnosis is really a family affair, and that it impacts everybody in the family. So we think about like the child with cancer, but then the issues for siblings, for parents, for grandparents are very real, and unlike in the adult arena where you may have an adult who's impacted and it may not have the same kind of impact on the family. There is no way that a child could go through this process without everybody being involved and really the rhythm of the family changing. So you think about how it impacts, the physical, the emotional, and the financial life of the family. And you're hearing from a lot of organizations today who do, I think, amazing work in helping mitigate against some of the resource issues that families face when their child is diagnosed. I think that one of the things to think about is really kind of how this impacts the many, many global ways in which a family thrives, both how they interact socially, how they see themselves in the world, how they work at their jobs, and how they, in fact, continue to do all things when they're facing what is perhaps like the biggest crisis that they have faced in their lives. So if you think about it, when you're at a treatment center, and just to think that many of you will have met your medical team on day one when your child was given the diagnosis, and one would hope that at that time you also met a social worker, because nationally, in most institutions, there is a social worker, a peds oncology social worker, who is part of that initial treatment center support. So it is often the social worker who stays back with a family after a diagnosis is made and tries to help put the pieces back together and maybe to interpret a little bit of some of what the medical situation is. I mean, there are many helpful professionals on the treatment teams, including obviously physicians, nurses, social workers, child life specialists, and in some cases psychologists and neuropsychologists. So again, social workers can really assist in the interpretation of information that's presented. They can help in helping families adapt to the illness, to really navigate the hospital system, and really to provide accesses to other resources and support. So I think it'd be interesting for you to know that there is an organization that has been in existence for 42 years called the Association of Pediatric Oncology Social Workers. And it is really a community of pediatric oncology social workers who share resources and experiences, come together annually for a conference, and really the cohort knowledge and experiences really help and strengthen the knowledge base of any of the individual social workers. So, for instance, if you are treated at St. Jude's or you're treated at NYU, for me, having been involved with the organization really for the past 40 years, I would likely know the person who was at your treatment center. And it really is it's a very helpful organization. And it has a website, www.aposw.org. And there are places where it discusses what the social work role is and function and resources, and also helps define what the expertise of a pediatric oncology social worker is. So I think that also, for those of you in the audience, you know that there are so many different things that influence what your journey is with your child with cancer. You know, the age of your child will determine some of how your child understands things, some of how they will cope, the kinds of support they will need. Somebody who is 2 needs very different support than somebody who is 14 going through the process, and then the different diagnoses each also require different levels of support. If your child is diagnosed with retinoblastoma, your experience is going to be very different than if your child is diagnosed with leukemia. So it is interesting to think about the different needs as they relate to the different pediatric childhood cancer diagnosis and what the protocol they're on. And, you know, sometimes people don't always think about how it impacts you as parents and as caretakers at all different levels, but it's also a very different experience if you are brand new to being a parent and your baby is diagnosed with cancer and you're not yet sure of yourself as much as a parent as you might be if the child who's diagnosed is maybe your third child and a little bit older, and you are further in your family development. So there are all different ways the impact hits you depending on where you are in life, and those things are kind of interesting and important to think about, and to think about the impact. You know, for some people, you know, they will have seniority in their jobs, or they will have their own business, and they will have flexibility to be with their child during the course of treatment. But for other people who are kind of brand new at their careers, or in a place where they do not yet have the rapport with their employer, they may face different challenges. And so, again, remarkable to know kind of what the resources out there are to help you, and to also help families think through some of the issues. The journey for siblings is a really complicated one, and it's interesting to think about family-centered programs, and I'll talk more a little bit about that at camp in helping siblings manage with what their experience is with the illness. So it's interesting to think about how social workers can be helpful with referrals to other programs, some which are going to be hospital based and in the community in which people live and the child is treated. Some are more local resources, but not necessarily hospital based. And then there's national resources and cancer organization, all the patient advocate organizations, and organizations that have a focus on family-centered care, and then family-formed organizations, which I think is one of the remarkable helps that exist in the childhood cancer arena, which are the many organizations that have been started by people who have gone through this journey, so they understand the needs in a whole different level, both the needs for further advocacy and funding for research, the needs for supportive care, and for sometimes the small things that make a very big difference in your life when you're just trying to keep everything together. I think that it becomes important for you to see your hospital-based social worker as not just as a resource themselves, but also as a resource to other resources. And you think about, there are a lot of special programs that exist in the childhood cancer arena, and interesting to think what's the importance of a special program. And some of what's important is that as you are raising your children and you think about kind of normal childhood and the memories that you create and what you do as a family, and I think when your child is diagnosed with cancer, you don't want to lose all of that while you are trying to keep yourselves together and to figure out how to manage the illness and all the various components of the illness. So you think about programs that enable you both to kind of find joy during a very difficult time, and to also think about things that create the memories within the context of your own family, and the kind of family connections that enable you to both feel strong as a family and to be able to kind of move forward and manage the day-to-day issues that childhood cancer presents for you. So again, if you think about the ways in which it is different, I think that for parents, when your child is diagnosed, you are as vulnerable as the child. And I think sometimes um, it is even harder for parents to go through the treatment process and to watch and witness their children to have to both manage things that both have physical pain and have kind of emotional anxiety to them, and always for the worry of the physical outcome for your child. So Camp Sunshine is one of those, I think, special programs that people refer to, and we are located on beautiful Sebago Lake in Casco, Maine, and we have been in existence since 1984. We have actually served over 50,000 family members thus far. We hope to serve around 750 to 800 families a year. We have served families in every state and 27 different countries, and we have been family focused since our inception, and we probably remain the only program that is devoted um, for 100% of the time year round to this family retreat model. So we, again, only serve families, and families come to us for generally um, 5 nights, 6 days, and they have an opportunity to become involved with both recreational and psychosocial programming. People hear the word camp and think that we run only in the summer. We run actually in 4 seasons with an upcoming program still with space available uh, in 2 weeks from now, kind of 2 February programs, and we have this Winter Wonderland. You can find out more about programming at camp at www.campsunshine.org. And again, we have an interesting. If you could advance the slides, that would be great.
Yeah, sure,
Okay,
sorry.
so we intend to have 23 sessions in 2018, and we have many general oncology programs, and we also have some very diagnosis-specific programs. And a lot of our work is about building communities within the context of a particular childhood cancer diagnosis. So there's a program for families of kids with retinoblastoma. We have many families of kids with Down syndrome who've had leukemia, who we know, for families of kids with Wilms tumor, for children with low-grade brain tumors. Think about kind of, again, as we said, like that difference between having a teen with a bone tumor versus having a baby with leukemia. So we have a number of programs for families of kids with inherited bone marrow failure disease. Sometimes um, people find that they love coming to a general oncology program. Sometimes they love coming and having the opportunity to work with or to meet other families who share many of the same issues that they have experienced themselves. Again, for children in the retinoblastoma community, there's the complexities of the issues related to sight and maybe to the loss of an eye and the very quick surgery and what that experience is for people. And then you have people who are on protocols that may be, 2 to 3 years, and then there's the different ongoing nature of kind of the impact of that diagnosis. So if you would go to the next slide, that would be great. Just an opportunity to see some of kind of the ways in which people have fun at camp. And then I wanted to show you the schedule, which I think is upcoming. Oh, so, and let me just for a second go back a second for that other photo. It's just an opportunity. Can you go back or you can't?
No, I can't.
All right. Okay, so we'll stop for 1 second. So there was a picture of a number of kids on a bench, which is a cohort of kids with Wilms tumor. And just to think about when you're just thinking like what's important to a child, we had one little girl who'd never met anybody else with Wilms tumor before the program, and suddenly there were 12 kids showing each other their scars and really kind of talking about their experience in a very casual way, the way that little kids would talk about things when they met somebody who shared a similar experience. So some of what happens when you bring families together is just kind of like the loveliness of like what the natural environment does to help people. So if you think about programs like family camps and like Camp Sunshine, you anticipate that they will provide, respite, recreation, relaxation, and fun. And then it's interesting what actually happens in that sense of community and connection and how people feel much less isolated, and kind of there is a real affirmation of what like the crazy life is that you live when you've been on the cancer journey. And there really is a deeper experience of support that is hard to describe, but it is almost that it's palpable. You can feel it by the end of the week. If you could go to the next slide, please. And again, families have an opportunity to both do very silly recreational activities and to meet in groups and have the opportunity to talk with each other. Next slide, please. And I guess we can just run through, but like just to think about Camp Sunshine, we have thought about that in some ways. Every family should get the recommendation to go to camp early on in their treatment phase, so that people live with the feeling that they are not alone and that really they are people who are kind of normal people in an abnormal situation, and being together with a cohort of other families really helps normalize that experience. In thinking about siblings with cancer, and just to put it on everybody's radar, often siblings have a different experience when a child is diagnosed with cancer, because they may be staying with other family members and in other situations. So it becomes really important to them to come to a place where they are as important as the child with cancer, and some of their voices are heard in different ways. And I think it enables families to really move together and move through this process in a very, very helpful way. So if we just, there's a lot of opportunities for siblings. Again, sometimes unless you ask, you don't know what a sibling is experiencing. And our recommendation is that siblings have a lot to say once they connect up with other siblings and they're in a very safe environment. So I would invite you to think about your social workers as people with many resources, and then think about the special programs that are out there, and to recognize sometimes it feels hard to say, oh, I'm going to go someplace for a week, but to recognize that the benefits in both learning other resources and finding other like-minded people, and remembering that your kids are still your kids and they will be kids always, and they need opportunities that kind of help them and help you as a family, again, find joy and thrive, and also find out about more resources and more information. Because what happens when you have 40 families together and they're talking about things is that it kind of fuels the energy of resources and help, and people make lifelong friends and actually learn about all different things, both in medical and child, and different resources. So again, see pediatric oncology social workers as kind of an integral part to your journey with childhood cancer, and kind of there to help you in many ways possible. Thank you.
Great. Thank you very much, Nancy. That sounds
You're
like a great place to go. I've heard about Camp Sunshine for years and known some people that have gone there. So if anyone on the phone is interested in that, please get in touch with Nancy and follow up on that.
Yes.
Well, I want to turn this over to Joey, and I will turn this screen. Hopefully this will work. Over to Joey. You can show your screen there. I know you want to give a presentation on the Hope portal, and I think this is a great resource that was built by community members for community members. So I think it's great to have you on. I'm just if you would tell us something about the genesis of it and its utility to members of the community, that would be helpful.
Yeah, absolutely. Thanks for having me on today. Thanks to Children's Cause for accomplishing something today that's just so instrumental to progress, and that's joining people together. I'm part of a very large collaborative group. Vicki from Coalition Against Childhood Cancer is on. Joe, who's also from the coalition and the head of the Be Positive Foundation. 8 months ago, I was fortunate enough to meet with them and with many other members of the coalition, and we started to talk about the current state and have a very real conversation about where are we, and some of the things that came out of that were that families still they feel isolated, overwhelmed. Sometimes they feel embarrassed to ask for assistance, and oftentimes a family might not even be sure what to ask for. And that we also have these incredible social workers who, frankly, are overworked. Well, sometimes they're overwhelmed by paperwork, and they even sometimes feel like they failed when really it's the situation they're set up. But incredible resilience. And then there's the nonprofit leaders who, as Nancy mentioned, they've many of whom have gone through this, the journey, and frankly, their nonprofits limited by resources, so that they end up having to say no to families, which is the worst feeling in the world, because of those limits. So the project is really a collaborative effort among many organizations to address this isolation together. And it's a continuous work in progress. As you'll see today, this is just the beginning, and there's a lot that still needs to be done to make it the best that it can be. But for like the next 4 minutes, I'd like to just dive into what the Hope Portal is and how you use it with a live demo, and stressing on the necessity of collaboration, not just the want. Like, we need people to provide feedback, families to provide feedback, nonprofit social workers, to make this the best that it can be. And you may hear me say that a few times, but if it helps this become something that's truly useful for people who deserve to have access to assistance resources. So the Hope Portal, really quickly, is an online tool to connect families to childhood cancer support resources. It's located at hope-portal.org is one way, and I'll show that at the very end. I'll show the website. But we also hope that it becomes distributed on many different websites. Thank you so much to Children's Cause for adding it. We hope that families are able to find this on many different nonprofit websites that they might visit, and that would be because the nonprofit leader was able to embed the site on their own website. So really quickly, I think I'll just walk through the process of a family searching for assistance resources. So right now we're on the homepage, and right here on the About link, you could read more kind of about the genesis of it, with the Coalition Against Childhood Cancer, APON, APOSW, KBI, and there are many groups that have been a part of this. There's recommend an organization. So if there's your favorite organization that you know is really active and helps families, we'd need to know about them so we can make sure that they're included. And then Joe McDonough made a really great point months ago that a lot of families may not speak English, and so there's a way to translate the site into Spanish. So what a family might do is search here things like bills. They could type info. They could search a certain organization's name. We have a lot of keywords that are added to this, but we've probably missed a lot too. And so if you search for a keyword and you don't find what you're looking for, please let us know. There's a feedback button down here at the bottom that we would absolutely love any kind of feedback or ideas on how to make this better. And then the search bar is if you kind of have something in mind, and if you don't, there's these filters that allow you to add a diagnosis that kind of will narrow down results. And you can also add a support category, and things like siblings, psychosocial resources, we have different kind of generalized support categories. And then there's the ability to type a city or state. Again, we may have missed some of the cities or states, and if we did, please let us know. So we'll just do some examples. Let's just say you were looking for bills. You could type bills, and the results would show all the organizations that are known for supporting bills. And this known for category is really important because the owners of these organizations have put that that's kind of what their organization's known for. So as a family, it's hopefully a way to add some clarity to what exactly does this organization do. So we'll do this. We'll do a couple more searches, and then we'll show kind of what happens when you click on one of these organizations. So someone might try bills. We might just try support generally. There's a great group, part of the coalition called Momcology. Someone might try, let's just say they're in New England, and they just kind of want to know about organizations in New England. You could see which organizations serve the New England area. And finally, let's try meals. And so Cure Childhood Cancer is one that's indicated in their category that they support meals. And so if we decide to click on that organization, hopefully what we tried to do here is very quickly add clarity to what does this organization do and can they help me? And so the known for categories are right here at the top. If you know of this organization, you kind of want to say thanks and help other patient families find them, because you really want to kind of endorse who they are as an organization. You can upvote them, but really you can go directly to the website by clicking here. And if you own the organization, you can claim it here. So that's kind of the top. And then if you want to dive a little deeper, here's the mission statement, the known for categories, and you can check out their Facebook or their Twitter. And then if you'd like, you can send the note directly to the organization. That would be private, but just to say thanks for what you're doing. This is incredibly quick, but I'm finished. I think that's hopefully the idea is to make this as simple and as fast and as effective as possible. And then the quick next steps I would see would be to, if you'd like, you could visit hope-portal.org to check it out and provide any feedback. info@cac2.org as a way to ask any other questions. And then if you have a favorite charity, invite them to embed this in their site. If you're part of a Facebook group and you think this would be valuable, we'd love to share it. And lastly, feedback. I think what's confusing about this, what did we miss? We're super open to and need feedback like yours. So I appreciate the Children's Cause today, and thank you for letting us be part of this meeting.
Yeah, thank you very much, Joe. That's wonderful. It looks like it was a lot of work to put that together, and I'm sure it's an evolving process. That's the conclusion of the discussion by the panelists, but we have a few minutes left to open it up for questions. So if you have any right off the bat, if you would like to type those in on the Q&A box on the right-hand side of your screen, we can entertain those. We have a few minutes left. But just to follow up, Joe, I'll give you one. I mean, it strikes me that there must be some kind of big Excel spreadsheet or something behind the website that somehow drives this. And what did it take to actually put this together? I mean, it looks like it was quite a bit of work in one sense.
Yes, yeah, it was a lot of work, and we've got a great team here, and folks from the coalition helped out, and I think even the folks that own their own organizations kind of helped fill in the gaps, and it did take a bit of front work, but we hope that it continues to be continually updated so that things stay active, and we have a point person now that it will keep make sure everything is active and that the information is accurate.
Right, exactly. Yeah, it's a great resource for the community, and it's great that you guys shared that with the rest of the community because the people, the foundations who are more locally oriented have that at their disposal, which is really helpful. Nancy,
Amazing.
yeah, one thing that I wanted to ask you about in particular is and this is probably hard for you to narrow down, but what are the more typical questions that families come to you or your colleagues with? And what are typically like the Hope Portal? What are the typical kind of indexes you use to refer people to resources?
I think it sometimes it really depends on where people are in treatment, and different issues present themselves at different times. I think at the very beginning, right, it really is like everybody is faced with this emotional crisis, and I think just survival is the like, how do you do this? How do you get through? How are you gonna change your life to really make this work? And I think that it becomes really that initial period is one of reframing many of the ways in which you look at things in your life to get through. But I think that, I mean, the financial burden becomes also very quickly an issue, because depending on the treatment for the child, every parent is going to want the opportunity to be with their child during the course of treatment. And we live in a society where in many situations, both parents are working, and so somebody will need to make a decision to leave work for a
Hmm.
period of time and to lose that income. So it's an interesting question about like which components of survival come up first for what people need. And I think some of it is helping people educate themselves as to what the illness and the treatment is to be able to make decisions
Hmm.
and think through that initial period. And then I think you move to kind of like the resources like we've been hearing about today, which really help people pull the other components of their life back. And says, I don't even think people know at the beginning what the impact will be. Like you almost can't be worried about what the impact will be on the entire financial security of your family until you um, can let yourself breathe after the worry of the impact of what the illness will do to your child, right? So I don't know if that answers the question, but I think there's like an order in which people's issues come to place. At the beginning is a very,
Hmm.
very hard time, so that the more access people have earlier on to resources, the better it helps them not lose step with their lives, right? Because some people don't realize that there are avenues for support until they're 9 months into treatment and already in tremendous debt, right? So I think that like the earlier access on all levels of support and resources, the more helpful it is for families. But it's hard to hear at the very beginning what you
Nancy,
need.
I, I would agree with you. I would certainly agree with you on that. We see the same evolution of concern through our work at Patient Advocate Foundation. And as you mentioned, the majority of patients come to us first and foremost for access to care. That's their number
Mm-hmm.
one concern. I had a surgery that was denied. I'd like to see a specialist. I'm uninsured. What can I do? I can't get into an oncologist. And it's only after they take a moment to absorb the impact of the diagnosis itself and become secure in the notion that they are in fact going to be connected with medical resources and begin receiving care, do they then look around and realize the ripple effect that it's having on their life? How do I talk to my employer? Well, how is this going to change my income? Well, how do I access disability benefits? Is this an appropriate time to access them? And I firmly agree with your comment that being proactive and reaching out to resources proactively as soon as possible is the absolute key to avoiding traumatic pitfalls that so many families find themselves in months and even years later.
Yeah. Hey, Beth, we're running short of time, but we did have a question about whether PAF services are free for families.
They are, George. All of our case management services are free. Our educational resources are free. Everything that we offer is free of charge.
That's great. That's great. It's good to know, and it's another source for people to go to when they need help. And I want to thank all of you for joining us today, and especially our panelists for contributing their insights, especially Nancy, Beth, Joe, and Joey. Children's Cause is going to be conducting more of these webinars through the year, bringing other topics and speakers who we think will be able to inform, but also provide some assistance on things that are very practical to people. The next one we have scheduled is in June, and that has to do with advocacy and tools for people in the Kids Action Network to be able to access. And if you're interested in that, you can go to the website and sign up for the Kids Action Network, and you'll get a free advocacy toolkit and some regularly sent tips and strategies on advocacy activities. So hopefully you will join us again when we have another one. But again, I want to thank everybody for joining us today. And until then, thank you, and please keep up the fight.
Thank you. Thank you for the opportunity.
Thank you.